War on cancer. For the past 50 years, war on cancer has been fought with three tools: surgery, cut, radiation therapy, burn, and chemotherapy, poison. Over the same period, there have been rapid improvements in technology and medical science. One would expect medical treatments and success rates for cancer to improve steadily. But have they? The answer is an emphatic no. Since 1950, the overall cancer incidence has increased by 44%, with breast cancer and male colon cancer up by 60% and prostate cancer up by 100%. 44% of Americans living today are expected to develop cancer. For decades, the 5-year survival rate has remained constant for non-localized breast cancer at 18% and lung cancer at 13%. Grouped together, the average cancer patient has a 50/50th chance of living another 5 years, which are the same odds he or she had in 1971. If one takes a longer view, the numbers become scarier. For example, the overall 5-year survival rate for breast cancer is about 75%, but the extended survival rate, beyond 5 years, is less than 50%. For prostate cancer, the picture is not much brighter, with 5-year survival at about 85% and 10-year survival at only 35%. Cancer according to natural medicine. While conventional medicine primarily treats cancer as a focal disease with localized symptoms, naturally oriented physicians think otherwise. Naturally oriented physicians think of the body as a closed internal ecosystem and believe that it is the dysfunction of this ecosystem that is primarily responsible for the development of cancer. No treatment, conventional or otherwise, can completely eliminate all cancer cells, according to the naturally oriented physician. The reason is simple. Cancer is a systemic disease, and there are simply too many cancerous or pro-cancerous cells within the ecosystem of the body. Cancer is not a localized problem, but a whole body phenomenon of metastatic growth. Its growth process is affected by biological conditions. Non-genetically based cancer forms in the body because of toxins, the lack of oxygen, poor nutrition, and other factors, such as hormonal imbalance. Whether the cancer in our body continues to multiply depends to a large degree on our body's biological terrain. It is this terrain that determines how the cancer is expressed. Naturally oriented doctors view cancer as a chronic, systemic and metabolic dysfunction of the genetical intracellular makeup. In many cases, it can be considered a controllable chronic illness. Tumors are only the symptoms of the submicroscopic dysfunctional causes. The root of cancer therefore lies in the progress of growth and metastasis, and not the tissue in which the tumor was first detected. The naturally oriented doctor therefore fights cancer by optimizing the internal terrain and enabling the patient's internal system to destroy the tumor. It enhances the patient's health so that cancer cells cannot grow and multiply.